This is NBC6 South Florida Today.
Welcome back. You know, non-invasive cosmetic procedures have become very common. They offer quick results and quick recovery time, too. You're literally in and out of the doctor's office and back to work the next day. But sometimes that quest for perfection can turn ugly. Plastic surgeon Dr. Martin Newman explains some of the myths and facts behind these minimal cosmetic procedures. Good morning.
Good morning, Kelly, and happy birthday.
Oh, thank you. I'm so glad you're here. I know a lot of the women who are watching have some questions, and I'm going to try to get them all in. And that is, first of all, define what is a minimally invasive procedure?
It's a good question. Unfortunately, there's no standard definition of what a minimally invasive procedure is. Many people will say less invasive or non-invasive, and they're using these terms more as promotional terms. The reality is that almost anything we as surgeons do involve some sort of intervention, sometimes lesser, sometimes more.
What about Botox? It seems like women are going in droves. In fact, I read when I was researching this that $1.9 billion is spent every year on these quote-unquote, and you said there's no set definition, but of non-invasive procedures, and a lot of that is the Botox.
Actually, that's right. The numbers are much higher. According to the American Society of Plastic Surgeons, about 83% of the $12.4 billion spent in 2007 were spent on less invasive procedures like Botox, Restylane, etc.
One of the more disturbing things that I wanted to bring up with you is the fact that many women are going to spas or salons and getting this procedure done, even Botox, thinking it's not that serious. What could go wrong?
Well, that's unfortunately the way most people may have been led to believe. The reality of the situation is that anything you do does carry risks, benefits, as well as alternatives. The risks from Botox should be discussed with the patient, and Botox should be delivered by someone who is trained to do it. Not a day goes by that at the Cleveland Clinic we don't see somebody coming in with a complication who has been treated in a less than correct manner.
Okay, so you have to go in there and fix it.
Yes.
Wow. Now, you know what the commercials that we're seeing a lot? I think they call it the Revita lift or the lifestyle lift. But it's, in a sense, real surgery, and they, too, say you can get in and out in a day. Tell us about that. Is that a good idea to have?
Well, I can't comment on a particular brand name, but what I can tell you is that there are many less invasive facelifts that are available to the patient.
Okay.
These less invasive procedures may involve less of an incision, less of a dissection. They may be able to be done under a local anesthetic as opposed to a general anesthetic, and for that reason may impart less risk. But you just have to ask, are you a candidate for these procedures or not? Certainly it is not a full facelift. That is, a mini facelift is not a full facelift, and whether or not the patient is a candidate for these procedures should be something they discuss with their plastic surgeon.
All right, we have some myths or facts here. Let's see. Non-invasive procedures offer no advantage over traditional plastic surgical procedures. Is that real or a myth? Actually,
that's a myth. There are significant advantages to the non-invasive procedures, and that's why they've become so popular. For example, there is, as I say, generally less of a risk because of the less risk for anesthesia. They're more available and they're more affordable. They are instant as far as results go, often. Sometimes a simple dermal injection may leave the patient leaving the office that day with a result. Botox, 3 or 4 days, appreciate a result. And certainly there's less downtime, less recovery. And these are advantages that seem to help separate the non-invasive and fuel the popularity.
Well, are you so glad that you got into this profession based on the fact that we do have an aging populace, men and women, and that's another myth I was going to ask you. Most people think it's women only. Not so much anymore, huh?
Not so much. For vocational reasons and other reasons, psychological, sexual, whatever, we are attracting a lot of men to the cosmetic arena, and they are coming in for their non-invasive procedures.
All right. Well, again, congratulations to you and your friends at the Cleveland Clinic for stopping in and kind of dispelling some of these myths versus facts. And by the way, for more information on non-invasive cosmetics procedures, all of them have risks. And I know a lot of you have questions, including price and what's right for me. The number to call for a specific consultation is 1-877-463-2010. Thank you, Doctor.
Thank you very much, Kelly.